My name is Dr. Shathil Parikh, and I'm the director of the Northwest Thyroid and Parathyroid Center. At our center, we've revolutionized the ability to manage thyroid surgery in the outpatient setting. We have patients that come in from all over the country and all over the world to have surgery at our center. We're able to perform thyroidectomy through a small 1-inch incision in the midline of the neck. Surgical times last between 25 and 35 minutes. Patients remain in the recovery area after surgery for approximately 30 minutes after surgery, and then they are discharged. Patients who come from out of town arrive the day before for a surgical consultation with me. They have surgery the next day, and then they're allowed to fly home or drive home the next day. We use small incision techniques, minimally invasive techniques, and at times we use cameras and endoscopes to be able to remove the entire thyroid gland through such a small incision. We perform between 10 to 15 of these surgeries every week. We are one of the busiest thyroid surgery centers in the country. Once the patient is asleep, we use our high-resolution ultrasound to identify the thyroid gland. The purpose of this is to specifically define where the thyroid gland is so that we can make our incision as small as possible and minimize our dissection. Here we are looking at the thyroid gland on the ultrasound machine. You can see it well visualized there. This patient clearly has nodules on her thyroid gland. Since we're able to precisely identify where that thyroid gland is and mark it, we can minimize our dissection. This thyroid gland is not palpable, meaning you cannot feel it based on where it is, and you can only use the ultrasound to appropriately identify it. So now, based on the ultrasound, I'm able to mark out an extremely small incision. You can see this incision is less than 1 inch, and through this incision we'll be able to remove the entire thyroid gland. There are 5 major benefits to minimally invasive thyroid surgery. Number 1 is the incision size. Average incision size at our center are between 1 and 1.5 inches. We are able to remove from the very smallest thyroid tumor to very large thyroid tumors through this small incision. Oftentimes incisions have to be extended if the tumor or the size of the thyroid gland is very large, but for the most part, the thyroid gland can be removed through this small incision. The second benefit is recovery time. Most people report that they are able to return back to work within 2 to 3 days after surgery. The benefit of the minimally invasive technique is we decrease the amount of surgical dissection, therefore the patient has minimal pain. And that is the third benefit of this surgery, is pain. Most patients who have surgery through the minimally invasive technique report that their pain levels are between 1 and 2 out of 10 the day after surgery. The fourth benefit is blood loss. Most of our surgeries, we lose less than 1 teaspoon of blood throughout the entire surgery. The fifth benefit is being able to do this surgery in the outpatient setting. Most centers who perform thyroidectomy require at least a 1-night stay in the hospital, sometimes even 2 or 3 days. At our center, we're able to safely perform outpatient thyroid surgery so you can quickly return home and begin the recovery process. So there it is, the surgery complete. What normally in most centers would take 2 to 3 hours and potentially an inpatient hospital stay, we've now completed in about 30 minutes, and the patient will leave the center in about 30 minutes.